This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
What immunizations, injections, and medications are okay to use during the cycle? Are there medications, immunizations I shouldn't be taking?
No. Everything is fine. COVID vaccines have been shown to be fine. All the other standard immunizations for pregnancy are fine. Some of the ones for international travel, yellow fever, because it causes a fever, you'd probably avoid having that. But other than that, no. I think virtually anything can be done during the cycle.
What are the factors that may contribute to IVF failure?
100. What contributes to IVF failure? When I sit down in my clinic every week, I know that 6 out of every 10 cycles where I put an embryo back in the last month, I will be seeing those patients, and their first question to me is, why didn't it work? I say 6 out of 10 on the basis that a 40% success rate. So we start with the first and most likely thing is that the embryo we created was genetically abnormal. And as I've said on many occasions, when you're 30, there's a 50-50 chance that the embryo is abnormal, even though it looks like a good embryo when we put it back. When we go to 40, it's only a 30% chance of a normal embryo, so 70% of them that we put back, even though they look as good embryos, are abnormal, and so on. So that's the main reason. If we genetically test the embryos to try and avoid that, we can improve the pregnancy rate up to around about the 60% mark from the 40%. But there's still a pile of women who still would turn up after an embryo transfer of a genetically proven normal embryo who haven't been able to conceive. So then we go looking, what are the factors in a woman? The uterus has got to be normal. So the lining of the womb has to be normal. The shape of the uterus is important. If they've got any fibroids that impinge on the cavity of the uterus. So we'll do ultrasound scans to check on that. Also, in inflammation of the lining of the womb, we test for that or treat it. Then we look outside the uterus. Is there anything in the woman's circulation that's against the pregnancy? We look for immune rejection is something that we do tests for, something called antiphospholipid syndrome. There's evidence that later miscarriage can be increased by blood clotting disorders. Whether it happens in early pregnancy, we don't know, but we test for it and treat them with blood thinners if that's the case. On the immunological side, if we find a positive result, we may use steroids. Then that's when we start to wonder. And really doing all of those testings, we still only end up finding problems in about 5% of failures. So there's this big gap of we don't know. What we do know is that the more embryo transfers that happen, the pregnancy rate does rise. That if you've got multiple embryos, then you're likely to have a greater chance of getting pregnant. But we still have cases, and they're very difficult to manage, where despite putting embryo after embryo back, we still don't get a pregnancy, and we don't understand that.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.